This is my Deaf Studies project video along the side of a speech pathologist. Throughout the course of this project, I chose to shadow a speech pathologist that works side by side with my goddaughter. I spent overall 4 weeks of shadowing and interviewing. I got to gather information on insight on patients, techniques, and assessments that were used, and overall academic and career requirements for this path. A summary of my 4 weeks: I interviewed my goddaughter's speech therapist assistant. Her name is Sherry. So this type of therapy takes place 1 time a week in my daughter's household with her parents being present. Either it's her mom, her dad, or the speech pathologist assistant takes place in the living room where the parents are easily accessible. During this time, the pathologist assistant help identify items with my goddaughter, such as Montessori toys that allowed her to recognize and name the items. Also, throughout this time, they learned ASL, so the proper sign for each item. And during her sessions, the speech pathologist assistant incorporated an iPad to show images on screen, chewy tubes to assist with the jaw strengthening, SGDS, which is a speech generating device, and Montessori toys. So keep in mind that my goddaughter has a speech impediment. She does not speak, so ASL is the primary use here. One of the key ideas I used when I interviewed Cherry were the types of patients that she offers resources to and the behavioral issues that she runs into. So she works with mostly infants. She works with children from different age groups, from infants to adolescents to grade school children. She works with one patient at a time. Some of her patients are autistic or on the spectrum. She works with deaf and hard of hearing community. She also works with children who have speech impediments. Some of the behavioral issues that she comes across is having these patients get overstimulated during the time of session. A lot of time of these sessions are either held in the facility or in the household. Sometimes, even though they are in their household, it is difficult to keep focus on what's going on. She does also run into some sensory issues, cognitive impairment, and for some of the children that do keep hearing aids, she also has ran into the issue of them keeping their hearing aids on. As mentioned before, my goddaughter does not speak at all, so primary use during sessions is ASL. Sherry has also mentioned that ASL is actually primary use for a lot of her patients. ASL is usually the first language for many patients. They also use some home signs that are picked up throughout the household with either parents, siblings. So these home signs are typically signs that are made up within the household community, small gestures for either eating. It typically is considered quote unquote like slang. It's not considered the proper use of ASL or the term, but it works to communicate with the child. Most patients learn ASL first and identify techniques to help them recognize items. And again, ASL is used primarily during speech therapy. So this slide is very beneficial to me. It's academic and career requirements. The reason being is I also hope to strive in this field in the future. What I grasped from her is that it is a requirement to have 100 hours of field work either through a program or with a licensed speech pathologist supervising. A bachelor's degree in speech pathology is the route that she took. Through communication disorder, I know there are programs that just offer certificate, license to practice speech language pathology, assisting in California under a licensed speech pathologist. So again, under their supervision. So they assist with setting up assessments with the clients, taking notes, scheduling under the supervision of a licensed speech pathologist. It includes but not limiting to setting up, again, the environment, taking notes, engaging in games or an activity which is used to help out her patients. And one thing about this career is no, you cannot diagnose a patient or a child. It is only the responsibility of a licensed speech pathologist, not the pathologist assistant. Some final tips and takeaways that I grasped from this project is all patients are different. Not one is the same, so that also means that their sessions are not the same. It is an absolutely rewarding career. Session can take place in the comfort of the patient's own home. It can also give you the opportunity to work in a school, home, or hospital setting, or even private practice. And what consists of this job is actually getting very involved with the patient, the child, and family as well, teaching them how to interact with the child, teaching them some techniques that improve communication. It does make a difference in someone's life. It makes a difference in these children's lives as well as their families and their parents and their community. It helps increase communication, which absolutely results to helping build confidence with not only the client, but the family as well. On the last slide, I've included a photo of my goddaughter during session. In this photo, what she is doing is they are using a book with photos of animals. The speech pathologist assistant is helping her recognize the animal, and then they are followed by the ASL signing for each animal. And that concludes my presentation. Thank you.